Hello, everyone. A very good evening to all of you. I'm Sayukta from Radiance with You YouTube channel, and I'm sure all of you must be doing really good. So, today we are talking about the essential role of moisturizers in managing dry skin disorders like eczema, psoriasis, or simple dryness. If you're struggling with dry skin, you're not alone, but we all know that moisturizers are key to keeping your skin healthy and comfortable. Dry skin happens when our skin loses the moisture and can't retain enough water. This leads to rough, flaky, and sometimes even itchy skin. Conditions like eczema or psoriasis may make this even worse by damaging the skin's natural barrier. We are going to have an important chat about them and how we can stop them from spreading by taking action early. So don't worry, we are not just here to talk about the problem, we are here to talk about what we can do about it. We'll look at how to manage dry skin from happening and talk about the latest treatment options. So let's connect today with our skin expert, Dr. Sonal Nagia. She is an MBBS, MD, DNB, and also runs this clinic, Mush Skin Care Clinic, which is located in central Delhi. Throughout her career, Dr. Sonal Nagia has contributed significantly to the field of dermatology. Her commitment to advancing the understanding and treatment of various skin conditions is evident in her extensive body of work. And with nearly a decade of experience in offering world class dermatological care to all her patients suffering from various skin diseases, it's such a pleasure to have you with us today, Dr. Sonal Nagia. Very warm welcome to you.
Thank you. Thank you so much. Good evening to all. I am, as she introduced, thank you for the introduction. I am Dr. Sonal Nagia and I head my clinic in Central Delhi.
So, Doctor, we are going to have a very important chat today, a very important session because winters are still here, and we
Right.
most of us at least, go through this problem of dry skin, dryness of the skin and the scalp, and we will love to talk about it. But to start with, Doctor, what are the causes of this, dry skin disorders?
Okay. First of all, I would just like to start the conversation by saying that moisturizers are for all. They're for everybody, but particularly for dry skin diseases. Now, dry skin, we can have dry skin in, say, we can have occupations which can lead to dry skin. Occupations like washermen, like people who do our hair, the hairdressers, the farmers, since they deal with soil, water, there's continuous washing of hands, say even the nursing staff, the doctors, we are prone to having dry skin. Then we have certain
Right.
endogenous reasons, like we have particular diseases, say atopic dermatitis, contact irritant dermatitis, eczema, psoriasis, even acne. It is very essential to use a good moisturizer in acne. And certain factors which we cannot stop, say pregnancy or after menopause, or say advancing age. People with advancing age, we lose our hyaluronic acid from our skin. So that's why we need to particularly put a good moisturizer to retain that. And then we have dehydration, anorexic patients, we have HIV, cancers, hepatitis B and C. So there are many causes of dry skin.
Right. Because we are talking about dry skin and dry skin
Right,
disorders, Doctor, I would like
correct.
to ask you who all are at risk of dry skin disorders. Those people who ignore moisturizing their skin or have a dry skin, are they even more prone of having, eczema, psoriasis, atopic dermatitis, etc.? Is dry skin one of the risk factors?
Yes, particularly people who do not put moisturizers or who inherently have a dry skin, especially like ichthyosis or patients with xerosis, they are more prone to developing what we say is housewife dermatitis, especially the housewives who have this continuous habit of washing utensils, hands, everything, cleaning. So we have housewife dermatitis where the risk actually increases 4 times if the patient is continuously keeping the skin dry. And also with patients with, say, dermatitis, generally it is hereditary, so it runs down your family cycle. But if patient has dry skin with atopy, then they're particularly prone to developing a severe form of disease.
Okay. Right. Now, coming to our favorite topic, the topic of today's conversation, moisturizer and its role. The thing is, doctor, as you said, very important thing in the very initial, as a very initial statement, that moisturizers are for all. But what happens, if I have a oily skin, I'll probably skip that step of using moisturizers or body lotions because, I'll feel that I have enough
Right.
sebum secretion. Why do I need a moisturizer? Even people with dry skin, they, focus on their face and neck and more importantly on the hands, etc. That's it. We normally do not emphasize or think that it is at all important to moisturize all our body parts, or at least those body parts which are exposed. So my question to you is why moisturizer is so important, and apart from our face, because face is something we all take care of, but other than that, which are the body parts where we need to moisturize on a regular basis? Plus, those who have oily skin or sensitive or many a times acne prone skin, they skip that step altogether. Why it's important even for them to moisturize their skin?
Okay, first of all, say in patients of acne, it is a very common misconception or a myth that I would say that since we have an oily, greasy skin, we do not want to put a moisturizer. So that is entirely false. Even in patients with acne, we need a light-weighted, non-comedogenic, non-fragrant moisturizer, and not just to retain the skin barrier, but also whenever we treat acne, we treat with many agents which causes dryness of skin. So it is all the more important that if we're treating acne with, say, a salicylic acid or a benzoyl peroxide or a clindamycin, isotretinoin, so we definitely need to put a moisturizer. Otherwise, we'll have xerosis, we'll have dry skin, cracky skin, and eventually the patient will not be comfortable with the treatment itself. So it is very important to put a good moisturizer in acne. So it is a complete myth that if we have oily skin, why do we need to put a moisturizer? No, we need to put a moisturizer. And the first question, which was, could you repeat the first question?
Yes, that moisturizer is important for everyone. And what are the points,
Yeah,
parts
yeah,
of the
yeah.
body that we need
Right,
to
right, right. The
moisturize?
body parts. Now, particularly moisturizer, starting off with the face, definitely, since it is the most sun exposed part. And our face, all the parts which are more exposed. So, suppose we are in summers, almost our entire arms, say half legs, if we're wearing skirts, so they'll definitely be exposed, and our face. So, it tends to lose the trans epidermal water, so that's why we definitely need to put moisturizers on areas which are exposed to sunlight, which are exposed to the environment. Also, we need to put moisturizer on the areas which are even not exposed, because every as we are speaking, as we are going through, there will be some form of transepidermal water loss. There will be some form of barrier dysfunction in the skin, for which we need to club it with a ceramide based moisturizer. So moisturizers are for everybody. So irrespective of whether we're sitting inside or we're playing outside, we need to put a moisturizer because it will benefit in the long run, definitely. It has an entire anti-aging effect. So we'll have less wrinkling if we put moisturizers.
Right. So moisturizer is very important, and irrespective of your skin type, please use moisturizer in case you are, not sure what is your skin type, or in case you have any dry skin related or any other, say, skin related
Right.
issues. Please consult your doctor because dermat will tell you what to use and what not to use. Because what happens, doctor, I'm sure you'll also agree with me. Market is flooded with products. Every now and then we are getting a new influencer who's endorsing a new product and we'll fall for it. Then there are so-called, customized moisturizers as per your skin type, etc. Fragrance free. There's so much to go for, and we get so confused that we keep on, experimenting. We'll use one bottle for say 2 months, then there will be a new thing. We'll fall for it. Is it a good thing to do, or we need to stick to one product?
Actually, the thing is, it is better to take a dermatological consult regarding what skin type, what are your concerns, whether you are a patient with, say, an oily skin type, or even a normal patient who thinks that, yeah, my skin is normal, but I need to start using a good moisturizer. So it's good, it's better that you take a dermatological consult. And secondly, I think it is more important to not fall for the Instagram influencers, because see, particularly we know ultimately they do not use those products. So it's quite rare that they use those products. So it's better to just uh, take a consult from a specialist, yeah, a dermatologist, and you take that consult. You can show your skin. We even have strips. We can even measure the amount of water which is there in your skin. We have certain instruments, so we can do that. We can test whether your skin is dry or whether it is oily in layman language, and which type of moisturizer would suit you best. So it is important. And yes, like regarding switching of products, in certain cases, suppose in patients with acne, we need to switch like 2 or 3 moisturizers. We need to have a particular moisturizer in summers, which is more lightweighted, which is non-colloidal, and then we need to have another moisturizer in the winter. So I think it is important to switch with the weather than just switching products without having any knowledge about it.
Right. And the best way is to go and consult a doctor, especially in case you have any skin related problem. Please go and consult with your qualified dermat to get the right product. Because what happens, पार्लर गए तो पार्लर वाली दीदी ने बोला कि दीदी देखो ये मॉइस्चराइजर आया है, ये लगाओ, ये बहुत अच्छा है, and we tend to fall for it. So it's not a good thing. Please take the experts' help, experts' advice, and in this case, the expert is a qualified dermatologist. Now, doctor, as you said, there are various, formulations, season-wise. There may be a need of changing your moisturizers, etc. What are the various formulations? Because we, especially those who have a oily skin, they find it so difficult to get a proper moisturizer for their skin type.
Right,
Then we have sensitive skin people, acne
right.
skins, etc., and dry skin, of course. So, what are the various formulations that are there, and who should go for which one?
Okay, so I mean, when we talk about moisturizer, it is a very layman term which was given by a pharma company actually initially. And
Okay.
when we study dermatology, we say we have emollients, humectants. So we have terms like this, which is very difficult to understand even for a specialist.
Right.
So it is not easy. But if we go and search for an ideal moisturizer, we will search for it in vain. So since it is highly subjective of the skin type. So what I would say is an ideal moisturizer, say when we're going and searching for a product and we're thinking, which one is the ideal moisturizer? And then we need to just take a few things in consideration. That is number one, the product should be non-fragrant. It should be hypoallergic. So certain words that are written on the crimp. So they should be hypoallergic, non-comedogenic. It should get absorbed easily. The spreadability should be good. If we say taking it for the entire body, and yeah, it should be light weighted for summers, and for winters it should be certain. There are certain moisturizers which have ceramides, which have oils, and which have oatmeal. So they are good. They're good for winters. And for summers, we need to take certain moisturizers which are light, moisturizers which even pharma companies which even like they market these products with acne based moisturizers. So those moisturizers are good for summers, while for winters we can have these oatmeal ceramide based moisturizers.
Right. And doctor, how frequently we need to use the moisturizer? What is the right time of applying the moisturizer so that the impact stays for a longer time?
Right. So moisturizers should be ideally they should be applied twice a day. So, but if a person wants to apply moisturizer, the best time is when we take a bath and we come back and we just the skin is damp. So we have just like put the towel over us. We have we've used a towel, and our skin is still damp. So they say that after taking a bath, within 3 minutes, if we apply a moisturizer, then it is the best form to apply. So just like after bath, we need to keep it in our washrooms. That is the best way to do it.
Right. And there's another thing in our society. We are so obsessed with our home remedies, with DIYs, etc. We love applying aloe vera, things that are natural. We love applying malai, during winters, or coconut oil, or sarson ka tel, mustard oil, etc., etc. So, and we are so obsessed with it that at any point of time, we would not like to, skip it or leave it. But then, as a dermatologist, as a doctor of skin, what is your take on all these home remedies or DIYs? Do they really work, especially in case there is this dry skin related disorders?
So, I mean, DIYs, it actually comes as a shock to many patients when we tell them that they do not work that well. So, say if you're talking about moisturizers, then the only DIY thing or the only kitchen-based thing that the patient can use is a coconut oil. That's it. And a coconut oil cannot replace a moisturizer. Only in, say, dry skin disorders, it can just say it can form a film and it can just reduce the transepidermal water loss. That's it. But a good moisturizer does much, much more than what a coconut oil will do. So you can just, if the patient wants to apply some form of oil or some form of DIY, then only and only coconut oil. And mustard oil, as you mentioned, it is highly allergic and it is even prone and known to cause many pigmentary related disorders like LPP, lichen planus pigmentosus, and irritant contact dermatitis. So it is highly allergic. So it should not be used. And say malai, these things cannot even penetrate in the epidermis or dermis. So their pore size is so much that they cannot even enter our skin. So they do not work as a moisturizer. The only thing that, yeah, you can apply is coconut oil. But coconut oil is, in summers, it will cause malaria. It will cause sweat retention, it will cause malaria, and it will cause other things. It will be more troublesome than being of any significance. So yeah, in say winters in patients, I only recommend coconut oil in patients with chronic plaque psoriasis or in patients with say atopic dermatitis who are using moisturizers, but then eventually they need some DIY product. Then yeah, you can it can be used as an addition, but not as a replacement of a moisturizer.
Right. So moisturizers are must, and especially in case you have any skin-related disorder, please stick to moisturizer. That will, keep your natural barrier intact, etc. Because whenever we talk about a regular skincare regime or a very basic skincare regime, we say that it is important to keep the natural barrier intact or to make your skin more healthy, etc., etc. But then we don't know what to use. We know moisturizers are important, and as you said, after taking your shower, the first thing that you need to do after patting it dry is to apply moisturizer. But apart from that, doctor, what should be a minimalistic skincare, routine that can keep our skin healthy? A very basic minimalistic
Right,
approach.
right. Okay, if I just need to like give out a basic minimalistic skincare routine, I would give out two actually. One
Okay.
is
Okay.
a very basic one. So we need to use a face wash, and the face wash also ranges. So if we have oily skin, we need to use the AHA based face washes with say salicylic acid, mandelic acid, kojic acid. So those. And if we have, say, dry skin, then we need to use cleansers, the non-foaming face washes or cleansers, particularly. So, first we need to cleanse our skin either with a cleanser or a foaming face wash based on our skin type. Then we need to apply a good moisturizer. So, we need to apply 1/3 of a teaspoon of moisturizer, and over that, we need to apply sunscreen. Sunscreen is a must, like a moisturizer, sunscreen is must, and we need to ideally reapply sunscreen every 3 hourly, 2 to 3 hourly, they say. and we need to do sun protection. That is for the morning. And for the evening, again, we need to cleanse our skin if it is possible, and we need to again put moisturizer and sleep. Now, this one is the very minimalistic, the basic one, which one must do. And the other one, which I would like recommend, and which is also basic when it comes to say skincare, but I would recommend people to club it with say serums. So in the morning, we need to cleanse or wash our face, and again, we need to prior to applying a moisturizer, we need to take say 2 to 3 drops of serum. So in the morning, we can use hyaluronic acid based serums. So they're good, and they can be given to. I can give it in entirety. Like if you're talking on YouTube, then you can use a HA based serum. You can apply it, massage it for say 10 seconds, and then again you need to put a moisturizer and a sunscreen. And in the evening, we can have two forms of serums. Either we can have the depigmentary agents that contain AHAs like kojic, salicylic, niacinamide, glycolic. So we can have those serums. Or if we have patients who are, or if we have like clients or patients who are say more than 35 or 30 years of age, then yeah, we can start retinol. But again, retinol is not for everybody, and you cannot like start it on your own. You need to ideally just take a consultation, the proper percentage, and then again, you need to put a moisturizer at night.
Okay. And doctor, there are so many questions, coming from our viewers. I'll take them one by one. So A Raju is here, and his question is: Are thick moisturizers better for very dry skin?
By thick, if you mean, say, occlusives, which are, which can cause occlusive, then in dry skin, like if you have certain diseases, if you have inflammatory disorders, say atopic dermatitis or chronic plaque psoriasis, itch contact dermatitis, then they are good. I mean, they can be considered, like especially glycerine with aloe. So they can be considered, yeah, they can be used.
Okay. Um, Abhishek Sen is here, and his question is: Can moisturizer prevent wrinkles?
Yeah, definitely. I mean, why do we get wrinkling? Wrinkling, we can either have static wrinkles or we can have dynamic wrinkles. Now, dynamic wrinkles will happen eventually because we're using our facial muscles. But for wrinkles, static wrinkles, which we say basically fine lines, they are caused because there is loss in transepidermal water in our skin. So while we're using our muscles and we use causing skin tension, then eventually they will be caused. So if we maintain good hydration starting from our 20s, then definitely you can compare it with somebody who has never used a moisturizer or who does not use a moisturizer, and you can compare it yourself. You'll definitely have less skin aging. And even all the more to prevent skin aging, you can use a good sunscreen over a moisturizer.
Right. So even a sunscreen works as an anti-aging thing, anti-aging product because it helps
It,
to save your skin from the photogenic effects. We have Chandramani with us, and her question is: Can teenagers use moisturizer for acne-prone skin?
yes, I mean, they have to use. And first of all, if when we talk about acne, the first thing I need to say is go get treatment first. Because, sorry, because in acne, we need to fetch treatment first. So you need to take a good consultation starting from your teenage years because eventually they lead to scarring. And when you will take the treatment will definitely have agents which will cause dryness, all the more dryness to the skin, say benzoyl peroxide or tretinoin, adapalene. So because we need to treat acne. And then we need to, even not just for the treatment of acne, we need to use a moisturizer, but also because there are many studies which show that the scarring of acne, the blemishes that are caused from acne, the pitted scarring, they all are reduced if we use a good moisturizer.
So, moisturizer is our key for a healthy skin. So, we need to start early, use moisturizer regularly for better skin quality. Meenal Verma is here. Her question is: do moisturizer help heal minor cuts?
Okay, if we talking particularly about cuts, by cuts I would reckon say abrasions or I mean cuts. If you're talking about fissures, if you're talking about fissures on soles or cuts on our fingers, then which are the early signs of like I said, housewife dermatitis. Then yes, we need to use occlusives. We need to use humectants, which are forms of moisturizers. We need to use. But if you're saying that you've got a cut from a knife, then then you need to just use an antimicrobial to prevent an
Right.
infection and for healing.
Yeah, I'm sure she is talking about some kind of trauma that
Right.
progresses into other skin related issues. So
No, no,
yeah.
trauma, we need to use antimicrobials.
Okay. Palkesh's here. His question is: can shea butter help hydrate skin?
Yes, I mean, shea butter can, we need to have our butters that we say nine butters or six butters of our skin, but shea is one of them, but shea alone will not help. So you need to have agents which have shea butters because just like using shea butter won't help. You need to have the primary agents first.
Right. I've seen many people using moisturizer with some water, mixing up moisturizer with some water, and then spread it all over their body and massage, etc. Is it a better idea, doctor?
Actually, no, it's not that better. For spreadability, if spreadability is an issue, then we need to use lotion instead of creams.
Hmm.
So that is a bit because it already has more water content. So we need to use lotion form and if spreadability is an issue, but and like I said, we need to ideally apply moisturizers just after bathing. So we need to towel dry our skin, and when our skin is damp we need to put moisturizer that will lead to better absorption of the moisturizer. But to mix it with water and then apply that, that doesn't work.
Many times what happens because in winters we are wearing so much of layers, sweaters, etc. Whenever we'll pull up the sweater, we'll see our hands, skin, etc. very flaky, coming off, dry. Even if we have used moisturizer before, but once we have that those sweaters, etc., it becomes so bad. Any way to skip that?
If we, I have been applying moisturizers immediately after taking a bath since many years now, and I can vouch for it that it will definitely be reduced. And in winters, we need to particularly use moisturizers twice a day. So if yeah, we having dry skin, then we need to reapply moisturizers, say even twice or thrice, especially if someone is prone to dry skin or asteatotic dermatitis that we say, that is patients who are particularly prone to dry in winters, they're prone to dry skin, like very dry skin. So with in patients with asteatotic dermatitis, we need to club it with say either corticosteroids, but moisturizers are a must at least like twice or thrice. So we need to reapply it.
Right. Doctor, we are talking about hydrating our skin with moisturizers. How important it is to hydrate our body to, keep our liquid consumption appropriate for a healthy and hydrated skin.
It is very important. We need to have our hydration even like we need to have even systemic hydration along with topical hydration. So we need to have the right amount of water. We need to have at least six to eight glasses of water. And it is, I mean, if you're not taking water content, if you're already dehydrated, then you're more prone to dry skin, even more. And if you're having enough amount of water, especially in winters, we tend to skip water. So we need to keep our water content at par. And along with that, we need to use a good moisturizer. It will be good. But yeah, if you're dehydrated, then it will lead to dry skin. If you're malnourished, if you're dehydrated, if you are trying, if you are into diet, certain form of diets, or say if you're anorexic, then definitely you will have dryness.
Right. So it's important to keep your body fit, healthy, keep yourself healthy, and that will get reflected on your skin as well. Now, because you spoke about this, that if you're anorexic or you're, not healthy enough, not eating well, then also it will show on your skin. Because it's winter, and winter I think is the best time to go for leafy vegetables, to beetroots, to carrots, etc., etc. What kind of diet can we go for, doctor, which can keep our skin healthy?
So diet, like I think diet is something which is the difficult part. Applying is easy, dieting is difficult.
Easy.
But
But eating healthy is important,
when we
right?
come yeah, eating healthy is important. So yeah, we need to have food which has more water content. And like you mentioned, it is winter time, so we can have our spinach, we can have our methi, we can have our sarso, our bathua. We can have those because it has more water content. And we can have our radish, carrots, and beetroots. So it is that will be good. And particularly we need to have like good amount of water, so we can have a water intake, right? And yeah, I mean, it is good. I mean, if we switch to green leafy vegetables and fruits, then definitely we'll be more hydrated because they do have more water. And with particularly a diet with more carbohydrate, it tends to dry our skin. So yeah.
Right. So eating healthy, staying active, sleeping well, etc. It goes a long way in maintaining good skin. Now, doctor, before we sum up the whole session, any take-home message for our viewers?
Yeah, I would just like to say that for I will give like two take-home messages, particularly in patients with acne. I would say that moisturizer is a must. So all the myths that we have, we need to bust them, and we need to start using moisturizers along with treatment. And secondly, I would just say that it's good to just take a consult and be good with whatever moisturizer the doctor is suggesting you, and you can try that, and you can give your feedback. And yeah, you can just apply a good moisturizer and be happy about it. You'll feel the difference in a month, I'm sure.
Right. So use a moisturizer regularly and use the correct moisturizer, the correct formulation. Or in case you have any doubt, please go and visit your dermat. They'll help you in choosing the right product, which will help you in having good, flawless, healthy skin. Thank you so very much, Dr. Sonal Nagia. It was wonderful talking to you. Thank you for taking out your
Thank
valuable
you.
time for this session and making it so informative.
Thank you.
Thank you. And this was issued in public interest by makers of Lulibol Lotion Advanced Genix, division of Hetero Healthcare. Viewers, thank you for your active participation in today's session. Stay connected to our channel and do not forget to subscribe and like our videos, which is Radiance with You. Thank you and have a great evening ahead. Goodbye.